What if I told you that this picture-perfect scene could also hold a hidden struggle? Welcome back to my channel. Today, I am going to touch upon a silent struggle that often goes unnoticed, that is a postpartum depression. Just imagine the darkness hidden in the joys of the new life that affects countless new mothers globally. So stay with me as we unveil the layers of postpartum depression in an effort to bring awareness to a problem that demands our attention and empathy. But before we get started, don't forget to click that subscribe button and turn on the notification bell so you never miss any of our informative videos. Postpartum depression, or PPD, is a type of mood disorder which can affect women after giving childbirth. It is different from the baby blues, which is usually mild, presenting within first 2 weeks after delivery and resolves spontaneously. PPD, on the other hand, is more intense and long-lasting. It usually presents in the later postnatal period, mostly around 6 weeks. As many as 80% of new mothers can experience baby blues, and 10 to 15% of new mothers can experience postpartum depression. Early recognition of PPD is important for the mother and baby. Being aware of risk factors can help healthcare provider and families to provide early help to mothers. Risk factors include history of depression or anxiety, traumatic life events, lack of social support, marital or relationship conflicts, pregnancies with complication. Now let's discuss the symptoms of postpartum depression: feeling sad and hopeless, excessive worrying, loss of appetite, low energy, mood swings, loss of enjoyment, lack of interest in normal day activities, excessive crying, poor concentration, feeling of guilt and failure, self-harming or suicidal thoughts, thoughts of harming the baby. If you experience any of the above stated symptoms, please notify to your healthcare provider. Now let's discuss the treatment options available for postpartum depression. The most common and effective treatment for postpartum depression is psychotherapy, also called talk therapy. Different types of therapy can be used, such as cognitive behavioral therapy, interpersonal therapy, and psychodynamic therapy. These therapies help mothers to identify negative thought patterns, help them address underlying emotional issues, develop coping strategies, and improve communication skills. Joining a support group which is specifically focused on postpartum depression can provide immense emotional relief. These groups provide safe space to mothers to share their experiences, learn from others, reduce their feeling of isolation, and make them realize that they are not alone in their struggles. The support of partners, family members, and friends can play an important role in a mother's recovery from postpartum depression. Create a supportive environment by encouraging open communication, sharing responsibilities, and seeking external help when needed. Stress and anxiety can be reduced with the help of meditation, deep breathing exercises, and relaxation techniques. Even brief periods of self-care can have a good effect on mood and mental health. Making positive changes in daily routine can immensely help in managing postpartum depression. Regular exercise, maintaining a balanced diet, getting enough sleep, and engaging in activities that bring joy can help improve mood and overall well-being. Antidepressant medications can be prescribed for moderate to severe cases of postpartum depression. It is important to consult with a healthcare provider before taking any medication, especially for breastfeeding mothers, as some medications can affect the health of the baby. It is important to note that the treatment plan for PPD vary from person to person depending upon the patient's need and severity of the symptoms. It is important to consult the healthcare professional to determine the most appropriate plan. If postnatal depression is left untreated, it can arise many problems for the mother and the child. Without intervention, the feelings of sadness, anxiety, and hopelessness may worsen and last longer. Postnatal depression, if left untreated, can affect the bonding process between a mother and her baby. The mother might find it difficult to connect emotionally with her child, which can interfere the baby's social and emotional development. Children born to mothers with untreated postnatal depression are more likely to experience developmental delays, behavioral issues, and emotional problems. The lack of emotional support and positive interaction from the mother can worsen these challenges. Mothers with untreated postnatal depression may neglect their self-care, not giving attention to healthy eating, exercise, and sleep, which may badly impact their physical health. The most serious consequence of untreated PPD is self-harm, suicide, or even thoughts of harming the baby. A mother suffering from postpartum depression may find it difficult to carry out her tasks. Her capacity to take care of herself, her child, and her family may be impacted by this, which can result in marital breakdown. Postnatal depression is treatable, and seeking help is essential. With the proper support and interventions, mothers can recover and prevent the adverse outcomes as mentioned before. If you or someone you know is experiencing symptoms of postnatal depression, it's important to seek medical advice for guidance and appropriate treatment options. Thank you for watching the video. I hope you liked the information. If you find this video helpful, don't forget to like, share, and subscribe to my channel for more health-related information.